week 4 presentation. I am doing a genetic disorder factor 5 lead-in. So factor 5 was discovered in a study on deep vein thrombosis, which is just vein, basically blood clots, and they were doing the study in 1994, the University of Leiden in the Netherlands. So the research team named it, obviously, factor 5 Leiden, after the factor 5 gene that it occurs in and the university at which it was discovered. So this specific gene mutation is thought to be a factor in 20 to 40% of serious blood clot cases, and by serious means life-threatening or frequently occurring or anything that poses an interruption to regular life. Blood clots are relatively rare in their cells. So the factor 5 mutation is pretty rare, and the complications that come from it are even more rare. So that's just an interesting part of this all, is that very, very few people in the population actually present any kind of complications from factor 5 mutations. What factor 5 is, the factor 5 gene has a lot to do with the clotting of blood in response to injury. So when you have the factor 5 mutation, the mutation doesn't respond with the essential clotting protein, which is called activated protein C. So what activated protein C does is it tells essentially your body that the blood doesn't need to clot anymore, and it will slow it down so that there's not overclotting. And the factor 5 mutation is immune to that response, and so it just doesn't react at all, and so it keeps clotting and clotting over time, which is not that big of a deal when it comes to injury, but it can result in blood that coagulates too easily and then creates clots in the veins or in the lungs, which is life-threatening. So the factor 5 protein productions occur primarily in the liver. So that's where all these proteins are coming out of. The factor 5 gene, again, occurs from the liver, and it controls coagulation in response to injury. So the mutation badly interacts with the APC, which slows down the clotting procedure, resulting in abnormal clotting, that's the mutation part of it. So the inheritance is interesting because actually a much higher percentage of the population have the mutated gene, but as you can see in these squares, so you'll see in this one over here, this is what most people who have it present like. So it's already pretty rare. Again, over here, 3 to 8% of the population have a mutated gene, so it looks like this. So that means that you have homozygous dominant parents, a parent with 2 regular genes, and then you have a parent with carrying a copy of the mutated gene here, and that results in, you have kind of a 50-50 chance of even having one copy. And even having one copy, there's not a ton of complications that come with that. So it's a recessive mutation. So if you're in a position that you're diagnosed with factor 5 bleeding, that means that both of your parents had to be a carrier, and you had to be in, one of 3 or 4 kids who have this particular mutation in both copies, and then you'll start to see a rise in complications from the clotting disorder. So the CDC calls a rare disease something that's 1 in 1,500, and having 2 copies of this mutated gene, the odds of that are actually 1 in 5,000, so that kind of gives you an idea of how rare it actually is. So diagnosis and treatment is kind of tough because it is so rare, and because it doesn't have any symptoms in itself. Just a mutated factor 5 gene doesn't always present symptoms, and even if you have 2 copies, that's not a guarantee that you're going to show symptoms. But it increases the likelihood of abnormal blood clotting, and so things that already increase the likelihood of blood clotting, like birth control, estrogen use, air travel, things like that, in combination with factor 5, kind of create the perfect storm for something that's potentially life-threatening. So the diagnosis comes from a DNA screening and a blood test. So they'll look at a gene test and a blood test to look at the factor 5 gene and the ABC protein to see if they're interacting as they should be, see how your body reacts to coagulants, that kind of thing. So the main health risks that come from factor 5 lead-in are pulmonary embolisms and deep vein thrombosis. So pulmonary embolism occurs when a clot forms either in the lungs or in some other part of the body, and they'll travel to the lung because it dislodges. They're pretty rare, but they're very serious, and if they're not caught, they have a mortality rate of around 30%. So symptoms of a pulmonary embolism are things like your lips turn blue, you have a lot of chest pain, kind of feel similar to a heart attack. And this can occur in a matter of hours or instantly, or it can occur over a period of days and just get worse and worse as your supply of oxygen is cut off. And a deep vein thrombosis is just a fancy name basically for a blood clot. So it occurs most often down in the leg. Symptoms are like extreme pain, swelling, abnormally hot. And these clots can be tiny, like the size of a fingernail, and they can be all the way up the entire vein, depending on how serious it is, when you caught it, everything like that. So the methods of treatment, once you're diagnosed, if you're diagnosed at all, a woman obviously would be taken right off of birth control, or anything that's related to like hormone treatment, because that will increase the likelihood of clotting. You can put on a short span of blood thinners depending on how serious it is, or some people with factor V bleeding are on lifetimes of blood thinner prescriptions. A lot of it's lifestyle related, so you change your diet to include more or less iron depending on the thickness of your blood at the moment. Daily use of compression sleeves or clothes on the affected area. So if you have a lot of clotting happening in the leg, you would be prescribed to wear a compression sock really often. There's clot removal surgeries that are really rare and specialized, and not a ton of hospitals are equipped to do them. So those are only for really severe cases, and then your exercise would be limited to low impact things like bicycling, or you want to avoid things like running or jumping or anything like that. And then you limit your air travel, because traveling at high altitudes is related to clotting as well. So you don't want to do anything that will increase your likelihood of something that's already pretty likely for you. So in terms of testing, there's not a lot that you can do, and there's actually some pretty interesting articles on why and why not to test for factor V, because there's not a cure for it, and a lot of the treatment is only lifestyle related, and the likelihood that you will present symptoms or problems from it is already really rare. And so they don't include it in prenatal testing in Missouri or really anywhere else, because it's so rare and it poses so little risk to people who are young and otherwise healthy. But the lifespan of a person with factor V lead-in is not limited in direct correlation. So a lot of times what will happen is that someone will get older and be on things like blood pressure medicine or heart conditions or anything like that. So lifespan of an individual living with factor V is not limited in direct correlation. So it'll be like complications later in life, like you'll be on, like blood pressure medicine or heart condition related things. And that's where factor V will start to arise, because clotting will happen more and more often. But as far as they know, and from the testing that they've done, there's not a ton of correlation between shortened lifespan. So that's good. And again, the best management for factor V bleeding comes through close supervision from a hematologist, which is just a doctor that specializes in blood disorders. Careful exercise with low impact, limiting your exposure to air travel, living in high altitudes, and having a diet that's rich in the right nutrients for thinning out your blood naturally. So the disease, I think I mentioned this already, but the disease is hereditary. I think we said this before too, but it mostly is inherited equally by men and women. Women are more likely to be diagnosed because they're on things like birth control, things like that. So they have it equally, but women are more likely to be diagnosed. And so it looks like women have it more, but that's not actually the case. Okay, these are just some resources and real life examples of things that have to do with factor V. So Stop the Clot is a helpful breakdown of the genotype and phenotype breakdown. So some squares and some transmission and what it looks like if your parents have the different variations and what that means for you if you haven't. So that's a good visual breakdown. And this is the article on the usefulness or uselessness of testing for factor V, and why that might not be a good choice is to include a lot of testing and money and time into prenatal testing. And then this breakdown on its own talks a lot more about deep vein thrombosis and the different ways that deep vein thrombosis can occur even if you don't have factor V. So that's a good breakdown for anything concerning that. And then there is a case study that was interesting to talk about. So basically, this is a real life example of a person that I knew. She was otherwise healthy. She was 21 and had no history of clots anywhere in her family, anything like that. Woke up in the middle of the night with some extreme pain, went to the hospital. Spent about a week doing blood tests and things like that before it was discovered that she was a double carrier of the factor V gene mutation, and that had resulted in a clot that ran from her right toe all the way up to her belly button, which is insane that it didn't cause an embolism. And it's sort of like a medical miracle, essentially, that she didn't die before they figured out what it was. So she had one of these specialized surgeries, and they actually went into the vein and kind of used like a net is how they do it. So they insert a small net and sweep it all the way up the vein to get the clot out, and then treat it over a period of years with blood thinners and exercises to thin it out. And it was actually found out that her mom's side of the family had always been carriers, and they had a history of miscarriage and unexplained blood clots that like no one had really ever put the pieces together until she had this life-threatening disorder. But it turns out that her mom was a double carrier of the gene mutation and had presented in different ways that were not blood clots, like the like miscarriages and things like that. And then her dad was also a carrier of one of the alleles, and so together they produced a child who had no mutation, and then her sister had one of the mutated but not the other, and then she had both. And so that, in combination with birth control, resulted in this like massive blood clot that's like in medical journals. So that's just an interesting thing that does exist and it does happen. It is really rare, but it does have pretty serious consequences if you're not paying attention and if you're not testing for it and if you're not looking for it. So that's an interesting thing. So that's factor 5 leaks. I hope this has been at least informative.